Ever wondered how medical professionals determine the right dosage of medicine for different individuals, especially infants and children? Well, let's embark on a journey to understand this fascinating science, known as posology. Posology, a term coined from the Greek words posos, meaning how much, and logos, meaning study, is the science of dosages. It's an integral part of pharmacology and plays a pivotal role in medical practice. It's about determining the optimum amount of a drug that can offer therapeutic benefits while keeping adverse effects at bay. Now you may wonder, why does posology matter? Well, imagine taking a medicine that's either too potent or too weak to treat your illness. It's not just about getting the right medicine, it's equally about getting the right dosage. And this is where posology steps in, ensuring that medicine is a cure and not a curse. Posology isn't a one-size-fits-all concept. It's a personalized science that takes into account several factors to determine the correct dosage for each individual. Age, for instance, plays a crucial role. An adult and a child suffering from the same ailment may not receive the same dosage of medicine. Similarly, weight is another vital consideration. A person's body weight can greatly influence how the body metabolizes the medicine. Health status, including the presence of any chronic conditions or the functioning of vital organs like the liver and kidneys, can also affect the dosage. Moreover, posology is particularly relevant to medical students who are the future practitioners of this science. It's important for them to understand and master this concept to ensure effective patient treatment in their practice. So, there you have it, a brief introduction to the science of dosages or posology. It's a science that ensures the medicines we take are safe and effective. It's a science that saves lives every day. Now that you understand what posology is, let's delve a bit deeper into it. So, what factors influence the dosage of drugs in a patient? You might think it's as simple as popping a pill or two, but the reality is far more complex. There are a multitude of factors that can influence the amount and type of medication that a patient requires. Firstly, let's talk about the patient's age. As we age, our bodies change, and so too does our ability to metabolize drugs. Children, for instance, have a faster metabolism than adults, which means they process drugs more quickly. On the other hand, the elderly may have decreased kidney and liver function, which can slow down drug metabolism. This means that both these groups may require different dosages than a young, healthy adult. Secondly, a patient's weight can significantly affect the dosage of drugs. This is because the distribution of a drug within the body is related to a patient's body mass. Heavier patients often require higher doses of medication, while lighter patients may need less. However, this isn't always the case, and it's why it's so important for healthcare professionals to carefully consider a patient's weight when prescribing medication. Finally, let's consider a patient's overall health status. Chronic health conditions like heart disease, kidney disease, or liver disease can affect how a patient's body metabolizes a drug. For instance, someone with kidney disease may not be able to excrete certain drugs efficiently, and this can lead to higher levels of the drug in their system. Similarly, a patient with a compromised immune system may react differently to certain medications compared to a healthy individual. In conclusion, the dosage of drugs isn't a one-size-fits-all situation. It's a complex process that requires careful consideration of multiple factors, including the patient's age, weight, and overall health status. These factors help ensure that a patient receives the right amount of medication, not only to treat their condition, but also to minimize any potential side effects. Having understood the factors affecting dosage, it's time to learn how these doses are calculated, particularly for infants and children. Calculating doses for infants might seem like a daunting task, but is it really? Well, let's unravel this together. We begin by understanding that every infant is unique, and their dosage calculations should mirror this individuality. The most important factors to consider when calculating doses for infants are body weight and surface area. Body weight is a predominant factor in dosing for infants. It's a crucial parameter because infants have a higher metabolic rate per body weight compared to adults. As such, medications metabolize differently, requiring careful dosage calculations. To calculate a dose based on body weight, we multiply the weight of the infant in kilograms by the recommended dosage per kilogram. For instance, if an infant weighs 5 kilograms and the recommended dose is 10 milligrams per kilogram, the calculated dose would be 50 milligrams. Surface area, on the other hand, is a more accurate method for determining doses, particularly for cancer medications and some antibiotics. It takes into account the physiological differences between infants and adults, such as metabolic rates and kidney function. To calculate a dose based on surface area, we use the Mostella formula, the square root of the product of the infant's weight in kilograms and height in centimeters, divided by 3,600. But perhaps the most crucial aspect of calculating doses for infants is accuracy. A minor error in calculation can lead to a significant impact on the infant's health. Therefore, it's essential to triple-check all calculations and consult with other healthcare professionals if in doubt. In conclusion, while the task of calculating doses for infants may appear intricate, it is manageable when approached systematically. By considering individual factors such as body weight and surface area, we can ensure that each infant receives the most effective and safe dose of medication. Dosing infants can be a bit complex due to their rapid growth and development, but what about children? Stay tuned as we delve into the intricacies of calculating doses for children in our next segment. How do we ensure that children receive the right amount of medication? Let's find out. The process of calculating medication doses for children is not a simple case of scaling down from adult dosages. Instead, it's a precise science that takes into account the child's unique physiological profile, including their age, weight, and body surface area. While the method of calculating doses for infants is chiefly based on their weight, the dosing for children is more nuanced. It involves a blend of weight, age, and sometimes even body surface area. The key is to strike a balance that ensures effectiveness without risking toxicity. Two common methods used are Clark's rule and Young's rule. Let's talk about Clark's rule first. Named after the pharmacist Taylor R. Clark, this rule calculates the child's dose by dividing the child's weight in pounds by 150 and then multiplying it by the adult dose. Remember, this is a general rule and may not be applicable in all cases, especially for children with unique health conditions or those on multiple medications. Next, we have Young's rule. This formula is typically used for children between the ages of 2 and 12. It calculates the child's dose by dividing the child's age by their age plus 12 and then multiplying it by the adult dose. Again, this is a general guideline and should be used with caution, considering the child's overall health status and the nature of the medication. It's important to note that these rules are just a starting point. Healthcare professionals must always consider factors like the child's overall health, the nature of the disease being treated, and the specific pharmacokinetics of the drug. And it's not just about calculating the dose, it's also about ensuring that the child takes the medication as prescribed, which often involves creative strategies to make the medicine more palatable, or to explain the importance of medication to a young child. Indeed, calculating doses for children requires careful consideration of various factors, but with the right knowledge, it becomes a manageable task. Scene script. Let's recap what we have learnt today. We began our exploration with the term posology, a fascinating field that revolves around the study of dosages. It's the pivot on which the medical world spins, determining how much of a particular medication is needed by a patient. We learnt that the very essence of posology is to strike a balance, ensuring that the medication is effective yet doesn't cross the threshold into toxicity. Next, we delved into the various factors that affect dosage. We discussed how the age, weight, and overall health of a patient can all alter the amount of medication required. We explored the role of individual metabolism rates and how they can significantly influence the body's response to medication. We also touched on the importance of understanding the patient's lifestyle and dietary habits, as these can interact with the medication and affect its efficacy. We then took a deep dive into the calculation of doses for infants. We discovered that it's not as simple as just scaling down an adult dose. Infants, with their rapidly developing bodies and immature organ systems, react differently to medications, We learnt about the importance of considering their body weight and surface area while calculating their doses. Similarly, we scrutinized the calculation of doses for children. We learnt that children are not just small adults, their bodies metabolize medications differently. Hence, their doses need to be calculated with utmost precision, keeping in mind their age, weight, and surface area. In conclusion, posology is a complex yet crucial component of medical practice, underpinning the effectiveness of treatments. It's a dynamic field that requires constant learning and adaptation to ensure the safe and effective use of medications. Remember, understanding posology is crucial to ensure effective and safe treatment. So keep learning, keep growing. Do not forget to subscribe for more.